So we're going to discuss the physiological changes that occur during pregnancy. Pregnancy has a profound effect on every system in the body. We typically think of the uterus as being the biggest change, but there are changes to every system. So we'll start with skin, integumentary system changes. You can see stretch marks. They are common as the breasts expand on the abdomen and also on the thighs. Women store about 7 pounds of body fat on their buttocks and thighs to provide for nutritional reserves for pregnancy and breastfeeding. So you may see stretch marks, dark or red in the beginning. Eventually they become pink and then pale or silvery over time. They really never go away. Used to be thought that you could use cocoa butter as a remedy for that. Maybe it helps or maybe it doesn't, but I would say that most people who are just genetically prone to getting stretch marks will get them. There's also the linea nigra, and that is a dark line. It goes from the pubic symphysis about to the fundus. You find it more prominent in women with darker skin. It gradually disappears after pregnancy. It's a normal thing. People can be taken by surprise by it. And a lot of the pigmented areas of the body do start to darken. The areolae around the nipples will get dark brown instead of pale pink. Moles might get darker, freckles might get darker. And then we have the mask of pregnancy known as chloasma. Darkens more with sun exposure and disappears after pregnancy. And that's right here. You can see stretch marks. You can also see the linea nigra right here. Some women get them really pronounced changes here and some don't. And then chloasma, or that darkening of the skin, it's caused by estrogen, kind of accelerates pigmentation. You can also sometimes see redness in the palms or palmar erythema. It's caused by increased blood flow. It's harmless, doesn't hurt, doesn't itch. The hair grows longer and thicker in pregnancy. A lot of women enjoy this. About 4 months after delivery, women will start to shed large clumps of hair. They don't enjoy that as much. But body hair tends to also become more coarse. Sorry, that is misspelled. That should be an A instead of a U. I will fix that on the final version. And abundant after pregnancy. Endocrine system. So all the hormones have to change. Thyroid hormones increase during pregnancy, increased metabolic rate, so that mom is able to supply the baby with more of what it needs. Insulin needs. Okay, so in diabetic and non-diabetic women, the needs for insulin decrease in the first trimester. And then after the placenta starts to put out hormones that antagonize insulin, we get a little bit of insulin resistance. And most women can overcome this. Their pancreas will just pump out more insulin in the second and third trimesters. Women who have any compromise in that situation, maybe they had some genetic tendency towards type 2 diabetes, maybe they're obese, or they have other issues with insulin resistance, like polycystic ovarian, you could see gestational diabetes. In your diabetic moms, you're going to remember that you have to decrease the amount of insulin that they're on initially, and then by the end of the pregnancy, it will probably triple the dose that they're on. Cortisol levels, that's your fight or flight hormone cortisol, increase in the second trimester of pregnancy. They do influence lung and neurological development in the fetus, so they may be slightly elevated. And then there's a hormone that we really don't see outside of pregnancy and breastfeeding in large amounts. It's oxytocin. You might remember from psych that it promotes love and bonding. Well, it also promotes muscle contractions of the uterus, which is important for labor and in postpartum. And it will help squeeze the small muscles, the small smooth muscles in the breasts to enhance milk ejection. The respiratory system also changes. Now it's everything is meant so that mom has more oxygen on board for the fetus. So oxygen consumption increases by about 15 to 20%. Respiratory rate increases by about 2 respirations a minute. That mild hyperventilation can lead to a very, very mild respiratory alkalosis. It's not pathological, but you will see it. The pH of the blood will rise a little bit. in response to this increased respirations. Now, interestingly enough, moms will usually complain that they don't have enough lung capacity to get a good deep breath in, but they are actually taking in about 50% more volume of air. And it's because the diaphragm kind of sits higher up as the baby grows. So it gives mom that sense of shortness of breath. But she's actually taking in more oxygen. The rib cage expands to the sides to allow more room for breathing. Now, that whole shortness of breath thing, I'm going to very briefly kind of tell you what's what with that. Mom might say, I feel short of breath, but she should be able to complete sentences. She should have a normal pulse ox, 95 to 100% on room air. She should have pink skin and mucous membranes. Her breath sounds should be normal. So if a mom tells you she has shortness of breath, you should really assess her respiratory status to make sure that it's just that normal dyspnea of pregnancy that's caused by everything being compressed a little bit. She might have to work a little bit harder to take that big deep breath in. But all of her respiratory assessment findings should be normal. If it's not, I mean, it's women with asthma sometimes have aggravations. You might find wheezing. Don't just blow it off. Don't dismiss it. If she's desatting, if she has anything wrong, investigate it. Increased estrogen also causes congestion in the mucous membranes. It's meant to provide blood flow to the mucous membranes of the vagina and cervix and uterus. But that congestion also goes to the nose. It's not specific to the female organs. And so what you'll usually find is nasal congestion and nosebleeds, and a relative swelling of the pharynx, trachea, and larynx, which might make intubation a little bit more difficult if you need to do that, but it's otherwise really of no significance. Cardiovascular system. Now, this is sort of an important concept, so I want you to sort of pay attention here. Blood volume increases and cardiac output with it by as much as 50% in pregnancy. Mom's heart has to work harder to supply 2 human beings, or maybe 3, sometimes 4, with enough blood and nutrients. So cardiac output increases. The heart rate's going to increase by about 10 beats per minute. The blood volume increases about 40 to 50%. To compensate for all that extra fluid, hormones are going to reduce the peripheral vascular resistance. So blood pressure should stay the same or slightly decreased. Increased heart rate is normal. Increased blood pressure is not. So remember that. The total blood volume increases by a lot, by 50%. But the red blood cell count increases to about 30%. So you get this dilution. The red blood cells increase, but not by as much. So you get hemodilution. So the hemoglobin and hematocrit values are going to look slightly decreased in pregnancy. That is normal as long as we're staying above 11 for hemoglobin and 33 for hematocrit. I'm going to give you a slide to kind of point you in that direction. We call this the physiologic anemia of pregnancy. It is a normal variation. White blood cell count also increases during pregnancy. You may see counts of like 6 to 12, and in labor, the pain, stress, and inflammation can drive it to about 14 to 16. It's not indicative of infection. So we have different parameters for white cell counts. And then we have a rise in clotting factors thought to prevent excessive postpartum bleeding. I mean, the body's evolved. Postpartum hemorrhage is the most common cause of maternal mortality, and the body's evolved to prevent hemorrhage. So we have a hypercoagulable state, and this can lead to a DVT, a PE, or even a stroke in extreme circumstances in women who are susceptible. Remember, pregnancy is a wellness process. It is not an illness. However, it is something of an extreme sport, and that's why it's designed for younger women to do it. And the body sort of trains for it, but the things that can go wrong happen because the body is under a little bit of stress here. Temporary changes in heart sound. So what you usually hear is like a systolic murmur. You may even hear an S3 sound, that third heart sound. Normal. It's because you have increased fluid volume on board. 11 and 33, remember that. That is your normal H and H. As long as it is above 11, the hemoglobin is not indicative of anemia. And as long as the hematocrit is above 33%, you're fine. When it gets below 11, we start to treat it as anemia, which is not uncommon in pregnancy. Urinary system also changes. So the kidneys work overtime. They are filtering more blood faster. They may even spill small amounts, gets a little bit sloppy, little bits of glucose and protein. Just be careful when you interpret that. Regularly spilling glucose in the urine is a danger sign, probably points to the need for further testing for gestational diabetes, and proteinuria is a symptom of preeclampsia. Small trace amounts of glucose and protein from time to time, not usually a problem, but should be followed up. Moms retain water because they retain salt and water through the tubules in the kidney. So, you have a water gain of 1.6 liters. And then going on to the reproductive system, this is where you see the most dramatic changes in pregnancy. The breasts become larger and fuller. They may become tender. That's usually one of the first signs of pregnancy, is tender breasts. The structures of the breast, the alveoli, the ducts and lobules mature. They will mature further when you establish lactation. Nipples and alveoli appear darker and brownish, and the areoli may enlarge. And then you'll see secretion of colostrum, which is a yellowish form of early milk. We call it liquid gold. It's produced from about the second trimester on. Some women have it leak. Some women can squeeze it out. We kind of discourage a lot of nipple stimulation in pregnancy before term because it does stimulate contractions through the hormone oxytocin. So there you go. There's your non-pregnant breast. It's still kind of immature. Women who's never been pregnant, her breasts are not considered mature, which is why women who have never had children, women who have never breastfed children tend to have higher rates of breast cancer. And there's your pregnant breast. And then when you're breastfeeding, you'll get a new picture when we get to that part, postpartum. Reproductive system. Now, for your most dramatic changes, you're going to see the uterus, vagina, and cervix change very dramatically. Between around week 16 to 36 weeks, you can take a tape measure from the symphysis pubis, stretch it to the fundus, and that should roughly equal the number of weeks gestation if it's a singleton pregnancy. So about 20 weeks, the fundus of the uterus should be at the umbilicus, and you can measure 1 centimeter, every week. So at 34 weeks, the uterus is 34 centimeters above the symphysis pubis. And it's a way we measure growth of the fetus in prenatal care. Mom's going to feel fetal movement at about 20 weeks if it's her first baby, and earlier at about 16 weeks in subsequent pregnancies. And that is normal, and it's an indicator of fetal well-being. So once mom feels it, she should consistently feel it. She should feel it more often and stronger as pregnancy continues. Round ligaments, these are these little ligaments that hold the uterus in place. Especially the first pregnancy, women may complain of pain on the sides of their abdomen, a pulling sensation, mild pain, discomfort, totally normal. Once those ligaments stretch, it'll go away. And some women will have Braxton Hicks contractions, or they'll perceive Braxton Hicks contractions throughout pregnancy, in the latter half of pregnancy, but they do occur throughout. And then you have increased vascularity of the vulva, vagina, and cervix. That can lead to Chadwick's sign, which is a bluing of the cervix. And there it is. There's Chadwick's sign. So if you look at the speculum and you have good lighting, a non-pregnant cervix will look pink. When the mom is pregnant, it looks purplish or dark blue. Musculoskeletal changes. One of the biggest things, and women will complain of backache during pregnancy, is that as the pregnant abdomen grows in front, the body compensates, shifts its center of gravity, and you have an exaggerated curve to that lower spine. It shifts the mother's center of gravity. It also increases the risk for falls because, you get a little bit clumsy with that. Hormones can increase the mobility of the pelvis for delivery, but they don't act just in that one spot. All of the joints will be less stable. So we want to counsel mom to engage in exercises that do not stress her joints, and use caution with that. And the round ligaments we already talked about, they position and stabilize the uterus. Again, totally normal. During pregnancy in the latter half, the abdominal wall separates in the middle, and that's called diastasis recti. It usually goes back to normal at some point postpartum, but mom should be cautioned not to do any crunches or anything that really stresses the abdominal wall. And here is what lordosis looks like. You see here in a non-pregnant mom or a mom in early pregnancy, the spine is relatively normal in curvature, and then it gets a little more exaggerated as mom grows. By the time mom is full term, she is really arched, and that can cause a lot of pain. The GI system also changes during pregnancy under the influence of hormones, HCG and progesterone. HCG is that pregnancy hormone. It maintains the corpus luteum. It maintains the pregnancy early on. It causes nausea because it activates vomiting centers in the brain. So that is a normal sign of pregnancy. Progesterone slows everything down. It wants to slow down the uterus so that we don't have forceful contractions that expel a fetus. Well, it also causes heartburn, constipation, and risk for gallstones. Everything slows down in the GI tract, all that smooth muscle. And the metabolic rate increases 10 to 20%. So to account for growing a baby and that increased metabolic rate, we want mom to eat about 350 to 450 additional calories per day. And you're going to monitor her weight gain for, in the first trimester, they really shouldn't gain much. It should be 3 pounds or less. And then it should be about a half a pound per week after that. More if she's underweight, less if she's overweight or obese. And then we're going to break here and we'll talk about discomforts of pregnancy and what we can do about them.